Hello, I'm Dr. Michael White. I'm the Chief Clinical Officer here at Valleywise Health. One of the most common questions that we receive is how long do we need to continue to wear the mask? And unfortunately, that the jury is still out. Certainly we know that it is safe per the CDC guidelines to not wear our mask when we're outside in well-ventilated areas. But inside, where the ventilation may be questionable, when we don't know the vaccination status of those around us, the most protective effect is to continue wearing the mask. I certainly see that these recommendations from the CDC and other agencies will likely change over the upcoming summer months. But today, with our vaccination rate not quite being at the 70% target that the president has set for us by July 4th, I certainly think that it is most prudent for everyone, vaccinated or not, to continue to wear a mask in the indoor environment. Once you've received your first immunization, you are given some protection in the two-dose series. So remember, we have 3 approved vaccines for COVID-19 disease in the United States. We have the 2 Pfizer and Moderna, which require 2 shots, and then the 1-shot vaccine from Johnson & Johnson. So if you receive the Johnson & Johnson, you are fully protected, from COVID-19 disease 2 weeks after that initial shot. For those that receive either the Moderna or the Pfizer that require the 2 doses, the effectiveness after the first dose has been demonstrated in studies anywhere from 50 to 70% effective in preventing COVID-19 disease. But most importantly, after you get that second shot in those 2-dose series, that protection against severe COVID-19 disease illness or hospitalization raises to above 95%. So it's really important to complete that to have that full protection against this disease. Certainly our goal with any vaccine and vaccination program is to achieve the majority of our population. When we talk about herd immunity and protection of the herd, we want to see that vaccination rate approach 80% of eligible individuals to be vaccinated to really be able to have that what we're talking about, herd immunity. Certainly, part of our role as healthcare delivery organizations and healthcare professionals is to continue to encourage those that may be hesitant, about receiving the vaccine, about the benefits that we're able to, prevent severe illness and hospitalization from COVID-19 disease through this. There is no need to, anybody to have to go through this severe illness. And we continue to learn about the implications of COVID-19 disease. We're only a year and a half into this. So what are the long-term complications that we might see from those folks that contracted this virus? We don't know that. So if we can protect it up front through vaccine and prevention, that is certainly our goal. After people have been vaccinated fully, and what I mean by fully vaccinated is you are 2 weeks past the last dose in whichever vaccine. So if it's the 1-dose vaccine, you're 2 weeks past when you received it. If you're in the 2-dose vaccine series, it's 2 weeks past the time that you received that second immunization. That's when your body has developed that full immune protection. Again, at that point, you are maximally protected as you can be in these types of environments. So going and interacting with other individuals that have been vaccinated is likely very safe. You increase the safety of those types of events if you're able to continue to wear masks, as you're interacting with others, probably do not need to maintain, the physical distancing that we were doing before, but I would still, be cautious of physical contact with others where you don't know their vaccine status. Certainly, this is an issue with many organizations that are coming to fruition is how do we return to our work environments where we have a lot of people that are in relatively close contact with one another to do this. So certainly some things that we can do to do that is, again, encourage everyone in this environment to be vaccinated. That is one of the key and most important things, around that we can do. Secondly is a lot of education around to individuals say, hey, if you're not feeling well, if you're, having a fever, if you have a new cough, if you're short of breath, those are times not to tough it out. Don't be the strong guy and come to work. Stay home until those symptoms get better and see your healthcare professional around that so we can make sure that you don't have the chance that you're bringing something into the environment. Within the physical space, it's really just in making sure that the ventilation is adequate, that the air handlers can, circulate the air as best as possible in some of these facilities. And then again, if the vaccine status is unknown, it does not hurt in those larger open environments to continue to wear a mask, as we get through these summer months and continue to get vaccine rates that are higher within our community, as well as see the percentage positivity rate continue to decline within our communities. We continue to read a lot about the variants and how viruses mutate. So all viruses, and COVID-19 virus or the SARS-CoV-2 virus is no exception, they will change over time. And that's what we talk about when we talk about these variants. What does that mean is, so far, the vaccines that we've developed, both Pfizer, Moderna, and the Johnson & Johnson, seem to continue to be effective against the modifications that this virus is doing in the community around it to prevent these severe diseases and illnesses. Is it possible that we will see a mutation that will require us to tweak or change these vaccines, that will require a booster or some other vaccine? It is certainly possible that we will likely and may likely see that sometime down the road. But today, with these variants, the good news is our current treatments, and our current prevention is working. But again, science continually changes as we learn more and see more about this virus. As we continue to vaccinate the population, we approach that 70 to 80% of individuals that are vaccinated. We will certainly continue to see our progression back to, life like before it was in the pandemic. There are certain things that I see that may never change from the pandemic, in the pandemic times. There have been some benefits, in our industry with healthcare, telemedicine, with its version, probably never going to go away. And that's a good thing. Do I see that some of these areas where masks are not needed in some of these environments improving? Yes, but we're likely into the late summer, early fall before we see these other big moves in that direction. So certainly, thank you again for your support of the Valleywise Health Foundation and all of the work that we're doing here within Valleywise Health to, make sure that we are able to deliver healthcare for all of those that need it within Maricopa County. One of those things that will help us get back to normal and continue to protect our population as a whole is really to get vaccinated. We've seen, hundreds of millions of Americans and, hundreds of millions of citizens across the globe that have received vaccine for COVID-19 disease, which really has demonstrated efficacy and the ability to prevent the severe disease and hospitalizations, and will hopefully help us get back to a more sense of the way we've interacted with one another pre-pandemic.